A number of years ago, I was getting frustrated with treating a number of individuals under my care as a forensic psychiatrist. It was at that point that I realized that I would have arrangements with the patients, and when the next session came, it will appear as if we had not talked about anything prior to that. And I got into a conversation, frustrating conversation, obviously, with a colleague of mine, a psychologist who had done a training in fetal alcohol spectrum disorder. By this time, I was about 14 years into my medical practice, and I felt I had known what the books had written about fetal alcohol syndrome at the time. And she recommended that I consider a training. And that started my journey in the whole area, and realized that in the medical field, and specifically in forensic psychiatry and psychiatry general, I had practiced with a significant blind spot, not knowing that certain behaviors and manifestations I was seeing or categorizing were as a result of prenatal alcohol exposure. So I started doing some research and teaching in the area, and got involved with a number of organizations through whom I developed an interest in the specialty of identifying those with mental disorders that were prenatally alcohol exposed, as well as how to help them, and actually led an international group that came up with an algorithm for treatment. Then I had a sabbatical year that came to me in 2018, and thought, what could be more interesting than spending the year doing something I've now come to enjoy? And so I really did a lot of extensive research, and thought it would be a good idea to put this guide together with the mind that this is something I would have benefited from a long time ago, and I wanted to be able to write some of my experience and expertise in line. So the availability of the sabbatical year, the length of time that I'd now acquired some expertise and knowledge, led me to the point of wanting to write this guide. I believe the primary audience that will find this really important will be those in the mental health professions, be those psychiatrists, psychologists, social workers, occupational therapists that practice with people who have mental disorders. Uh, as a mental uh, expert myself, mental disorder expert myself, I had in mind to help my colleagues, as I mentioned earlier, having thought that this is a guide I would have benefited from in helping a lot of patients. I think they will be the primary audience. Recognizing, however, that the abnormalities that prenatal alcohol exposure opens up to in many people is a wide range, including physical problems and many systems in the body that are affected. So generally, those in the medical field will also find it useful. Now, the area of fetal alcohol spectrum disorder has actually grown in the last couple of years to now having networks of colleagues and multidisciplinary team members that do both diagnosis and support. I also geared some of my writing towards those individuals. I also believe, lastly, that there are a number of policymakers as well as caregivers and frontline staff that deal with individuals with FASD that will find some content useful for the work that they're doing, in the context that whatever information was written was trying to help the individual first recognize what are the red flags, as I call them in the book, and as well, once you identify the red flags, what are the moderated plans that need to be put in place? So the mental health professional, the medical experts, and then other members of the public. Right. The only addition I would say is that one of the things I've come to learn through the process of course, as I mentioned, blind spots, is that there's a lot of blame to be thrown around. And so in reading the book, people may feel that they should have known something earlier. And I always use myself as an example that I was in active practice for 14 good years before I learned to identify these individuals. So there's really no grounds for blame. We should be willing to read, understand, make some changes, just have a growth mindset that will say, I'm going to learn about the important factors in the genetic, the environmental, and apply it to my patients. So that's just my encouragement, that people shouldn't beat themselves up for discovering something late in their profession.